Hi, this is Paul Slatkus, Good News Planet. I'm speaking to Sandi Delack. Hi, Sandy. How are you?
I'm great. How are you, Paul?
Okay, good. I'm very happy to get to speak with you. The president of the National Association of School Nurses, a board-certified practicing school nurse, and you have a lot of letters after your name. I don't know what they mean, but BSCN, MED, You must know your nursing. I want you if I ever need a nurse, because you.
Well, thank you.
What is it about a nurse that people love them? When what is it?
The Gallup polls have shown that nurses are the most trusted professionals because
Really?
That
Wow.
people feel that the nurses have the best interests of their patients at heart, and they're accessible to people. They take the time to talk to people about their health concerns. So, yeah, nurses are pretty well respected.
Okay, so we're going to talk about doing an Emmy Award, Academy Award, but they're all, the awards thing is not necessarily the name of the game. The name of the game is doing what you're doing, right?
The name of the game is keeping people healthy, right?
There it is.
Teaching people how to care for themselves and live as healthy a life as they can.
Okay, that's a beautiful thing. We're going to talk about the flu, the pandemic, right? Am I saying that wrong? Is over.
Pandemic, yeah.
Okay.
Pretty much.
So it means that we're not as nervous as we have been in past years about the flu, but it still remains a threat. And the good news is that there is still an ability to get a flu shot. That's also good, right?
Absolutely. We had our scare with H1N1 last year, but the good part of that is that it raised awareness about the flu, because the flu really is a serious illness that can attack even healthy people. It's associated with substantial medical costs, up to 200,000 hospitalizations every year in this country, and thousands of deaths. So although that pandemic threat seems to have subsided, it's really important that people understand that flu is still a real serious illness.
Now, what should they do? It seems like they're more accessible. I mean, I went to my doctor, and I've talked to like government officials, and everybody says that everybody should get the flu shot. They seem quite believing that that's going to be helpful for us all.
You're absolutely right. For the first time this year, the CDC is recommending universal vaccination, which means everyone 6 months and older should get a flu shot, so they're protected against the seasonal flu. The CDC is they have a take three approach that they call it, toward fighting the flu, and that's the first prong of that approach is get vaccinated, make sure that everyone gets vaccinated. The second piece of that is practicing good hygiene, making sure that people understand the importance of washing their hands, not touching their mouth and their nose, so you don't give those germs an opportunity to get into the body. Making sure that you cough into your elbow or sneeze into your elbow. And also staying home when you're sick, and staying away, avoiding sick people, so you're not in close proximity to sick people. And then the third piece of their Take 3 approach is, if you do get sick and you feel like you have the flu, to call your doctor, because there's medication that you can take, prescription medication, antivirals like Tamiflu or Influrnza, that will help to lessen the course of the flu so that you don't have complications from flu.
Okay. Here's an interesting question. Tips on smart hygiene habits amidst germ-spreading Halloween activities.
Yes. Well, anytime we have gatherings of people or kids, there's certainly a higher potential to spread illness. So, again, it's a lot of common sense, but you want kids to not be taking a bite of their candy and sharing it with their friends, being careful of sharing Halloween masks where they've breathed their germs into the mask and then share their mask. Makeup or lip gloss or anything like that they can share where they might be spreading germs. Then there's the old bobbing apples. I don't know if kids do that anymore, but it's really not a good idea to have a bunch of people put their mouths into the same bucket of water.
Okay, all right. How to break the sick cycle. What's a sick cycle?
Well, we see the sick cycle when we have our kids come to school and they get exposed to germs like flu germs, And kids are 2 to 3 times more likely to get sick with the flu, and they also shed a lot more of that flu virus, so they spread it to other people more easily. But they go to school and get sick, and then they come home and they give it to mom and dad and grandma and baby sister and anyone else that's living in the house. So what we want to do is try to take all those steps so that if they do get sick and come home, you can consider things like calling the doctor and getting antivirals actually to prevent the rest of the family members from getting sick. And then again, practicing those good hand hygiene habits so that they're not spreading their illness in the home.
Okay. How does someone become a school nurse?
It varies a lot across the country and depending on the state they practice and the regulations, but most school nurses are registered nurses with some experience in the hospitals or other acute care settings, so they develop those assessment skills and they're able to go out and practice independently because in most cases the school nurse is the only health professional in the school, so they really have to be pretty sharp with their skills and ability to understand.
And what are like educational requirements?
Again, it varies across the states, and I can speak for my state. It is on our end with a bachelor's degree and then additional coursework, and we are certified by the Department of Education to practice as school nurses in our school.
What state are you in?
I'm in Rhode Island.
Okay. And a big heart?
Yes.
I see you have a website here, National Association of School Nurses. What's on the website here?
We have a lot of information there for parents to do with the flu and many other topics that might be of interest to parents, but our flu section really has a lot of tip sheets and things to do, how to know. One of the questions that school nurses are asked a lot is, how do I know? How do I know if it's the flu or just a cold? So we talk about things like flu symptoms are sudden onset. You feel very sick very quickly. You feel like you've been hit by a truck. Where a cold might be, a little scratchy throat, a runny nose that develops gradually over several days. But those kind of tips that help parents understand what's going on with kids.
All right, it's all good. I want to thank Genentech also. They're helping to support this influenza education outreach. That's a good thing. We like good corporate citizens. That's always helpful.
That's right.
Let me ask you a question. What's good news for you?
What's good news for me is healthy kids in school and ready to learn, and that's what school nurses want to see. We want to keep our kids in school because they need to be there in order to learn. So
it's all good. All right. Do school nurses still wear a uniform? Do they come in with a nurse uniform?
No, most school nurses will wear street clothes. A lot of them wear lab coats just to keep that kind of clean environment.
Okay, beautiful. Well, I think the world of a nurse, and the school nurse. I agree with you. It must be not such an easy job though, because children do get ill often, I guess.
They sure do. In fact, one of the things that I really emphasize with my parents is to make sure that they have a plan so that if the kids are sick, they know what to do, and then trying to keep them home. It's hard on parents because a lot of parents don't have sick time. They need to go to work, and they may not have that child care option with their sick kids. So we do see a lot of kids come in that probably should be kept home on the couch for a day or two.
Okay, and then flufax.com as well. There's some more information specifically on the flu?
Yeah, and FluFax is a great one because you can put in your zip code and find out exactly what's going on in your area as far as flu activity.
Well, that's important.
Yeah.
All right. Well, thank you very much. It's a real honor to get to speak with you, and congratulations on your organization. However we can support you, give me a holler.
Thank you so much, Paul.
Thanks, Andy. Take care. Bye-bye.